Hey everybody, I am back again with another video. Yay, cancer talk. Um, I don't have my dog running around this time, but now I do have my cat hanging out next to me, one of them. Um, so a couple things from last week. One, for whatever reason when I was talking, I said I was 24 weeks pregnant when I was diagnosed, and I wasn't. I was 17 weeks pregnant and 24 years old when I was diagnosed. So apparently I told my story too many times and I just forgot it. I don't know. Um, and another thing I kind of want to touch base on was about my breast cancer spiel. And no one said anything. But after watching my video, I went back and I was like, that could rub someone the wrong way. I stand by what I said, but I don't want to downplay any cancer. All cancer sucks, no matter what it is. But my point is, breast cancer is the most known. And to give a couple examples, I was searching for a survivor cake, I guess. My friend was finishing her chemo for her non-Hodgkin's lymphoma, which is a neon green ribbon. And so not pink. And I Googled like some ideas or something, and I even typed in non-Hodgkin's lymphoma, and still you type in cancer and it's just flooded with pink ribbon. And so I get a little agitated that that's just the focus. And I just wish that every cancer had the same awareness out there, just as breast cancer does. And so that's just my 2 cents. I don't want to get too far into it. I'm sure I'll go on rants and later videos because I tend to do so, especially when it comes to cancer. So today, once again with my list, make sure I hit on some things. So I told you guys my story briefly last time, but I kind of wanted to talk like step by step in the diagnosing process, not just the initial diagnosis, but like what things you could go through, emotions, thoughts, medical teams, and just kind of do it not step by step because it's not like a learning thing, like I'm teaching you how to do it, but just like each video has a new part of a story. And I've had some people comment on my last one, not necessarily on the YouTube page, but to me, and just their feedback is, really, really appreciated and really great. And also, if there's stuff that people want to hear about or to know about, and I haven't touched on it, please send me a message and be like, well, what was this like for you? Or, something along those lines, and I'll get to it. But for right now, I just kind of want to go to the initial diagnosis part. So it could happen, obviously, a lot of different ways for everybody. I'll base it off of what happened for me. I was in and out of the ER, I don't know, 3 or 4 times before I was actually diagnosed with cancer. And I went into the ER because I thought I was dehydrated. So I didn't even go because I was like, oh, I need a colonoscopy, which I didn't get, by the way, until after I was in remission. Excuse me. Side note, while I'm on colonoscopies, they say that colonoscopies are now for people, or not now, but for people ages 50 and over, unless you have family history, and then it's 10 years prior to when they were diagnosed. So I was diagnosed at 24. My daughter will have to get it at 14. I'm okay with that because that's not as bad as going through the shit I went through, pun, for my cancer. But all I'm going to say is, if you have any concerns, and not just colon cancer related, any concerns at all about anything on your body, advocate, advocate, advocate. Tell your doctor that you know something's wrong. And yes, they have the degrees and they have the knowledge, but they don't know your body like you do. And that is so important for you to push. Don't, because that's how myself and a lot of people were misdiagnosed. Oh, it's just you're pregnant, or side effects from being pregnant, or side effects, whatever, you get it. Oh, it's just IBS, it's just hemorrhoids, it's just this, it's just that. And they have an explanation because they're afraid that you're too young and they don't want to give that news. And that's just how people get to late stages, as I did. Off my high horse, or soapbox. I'm on a roll today, screwing things up. Anyway, so diagnosis. So I was diagnosed in the room. So I had surgery on Monday. Saturday, I was told I had cancer, but I was told by myself in the room. I was just out of ICU, and it was a Saturday. My parents, I think, were going to come later that day to visit or something. And so the hospitalist, not even the surgeon, not even like one of my doctors that were watching, like some dude walking the hallways because he had nothing else better to do with his time, like came into my room with a female nurse, and bless her, she was amazing. She was amazing. Nurses, shout out, you guys are the true MVPs. But he sat down at a chair just next to my hospital bed, and like one of those, like, you know, chairs from like kindergarten, like plastic shitty chairs. And he sat down in it, and he was like, well, pathology reports came back from Albuquerque, and unfortunately it is cancer. And then just stopped for a second and was like, do you have any questions? I was like, fuck yeah, I have questions. I'm 24 and I'm pregnant. Like, why wouldn't I? But of course, at the time I said no. So at that point, it like didn't settle. Like, yeah, okay, hearing cancer sucks. And you're like, oh shit, I was just told I had cancer. But then you're like, no, I don't. And I cannot tell you for how long I waited until they came back and told me they screwed up the chart. Like you see on TV. Yeah, I was waiting for them to be like, oh, we had the wrong chart, so sorry, or we mixed up, or oh, we looked at this incorrectly, or I was looking for anything to tell me that I didn't have cancer. That wasn't the case. So the nurse was awesome, and she brought back like all this paperwork that made absolutely no sense to me. I mean, now it does, because now I get it, but it was just paperwork upon paperwork upon paperwork about colon cancer, and you're reading it, or not you, I'm reading it, and I mean, it says everything about 50 or don't worry about it until this, it, you know, prominent in males. And that's not true. It affects both men and women. It's the second deadliest cancer in both men and women in our country. So no, it's not just a man's disease. But I decided to call my parents after I was reading the papers because they just weren't making sense to me. And I told my mom, I was like, yeah, they came in and told me it was cancer. And then we both just froze, like, what? And then, so she's like, okay, we'll be right there. And so as they're on their way in, I think that's when I first cried, honestly. But I'm reading all these paperwork, and she brought back pregnancy and colon cancer. And let me tell you, there is no literature on pregnancy and cancer. And anything that I read, it was just not good. It was just, oh, by the time you're diagnosed while pregnant, it's too far, and don't have long to live, and blah, blah, blah. And I'm like, great, it's super awesome to read, but no one's here to interpret what this lingo means for me. And so that leads me kind of into the medical lingo thing. I've had to tell doctors to dumb it down, so to speak, like speak in a way that I'm going to understand. Like, I have my master's degree, but it's not in physical health. So I don't know all this mumbo jumbo, especially when it comes to cancer. Like, why would you just act like I was in med school right next to you? Come on. So it was frustrating. But already I was just mad at the hospitals for telling me, like, it wasn't even worth his time to come in and tell me I had cancer. Like, oh, okay, sorry to have interrupted your day to be sick. But I get transferred to Lubbock, Texas, which is about 2 hours from where I was, and there is, like, it was a university hospital, so it was huge. And there is where I had medical team after medical team after medical team. And it is intimidating, and it is draining and exhausting, and it takes a huge emotional toll on you because I am super, I don't know, I'm a pretty nice person, especially when it comes to someone that's taking care of me. And so every new medical team, every new person, even if they were on the same medical team, they just didn't come in at the same time. I was sitting there freaking out about my unborn baby. Didn't even know the gender yet. That's not even, I wasn't even far enough along for that. And about this incision and this shit bag on my stomach. And I'm like, I'm 24. I'm not supposed to be wanting to hide and not swim. And every time like someone come in, I'm like, oh, hi, how are you? Like, I need to be nice to them. Like, they had the bad day. And so it's just so it takes an emotional toll. And not only that, but you don't remember the names of these staff members, and you don't even remember where they came from. I had skincare nurses, I had ostomy nurses, which is basically at the time in my head the same exact thing. Like, but the ostomy goes on the skin and it can cause irritation, so that it's just a whole freaking ordeal. And then I had high risk OBs, and then I had my oncologist, and then I had the fellows for every one of those medical teams, and everyone was coming and telling me their name like I'm going to remember it. And not only that, but you have a different nurse, as they change shifts, and they may not be there the next day because it might be their next 2 or 3 days off. And so you just have all these nurses that you need to trust and make sure you're getting the right medication, and your wound stuff is getting changed on time, and you're getting help taking a shower. And I had a PICC line in my arm, so it was just like something in here going through and across into like a main vein. And let me tell you, it feels freaking weird getting pulled out. It's really intimidating to have all these people on your team in and out of your hospital room checking on you. Not to mention that when you are admitted to the hospital and they're like, oh, get rest and heal, but at 3 o'clock in the morning, we're going to come banging on your door to get some freaking blood. Yeah. Okay, I'll get rest. When? Never. And because the freaking doctors are making their rounds at like 6 in the morning, right after you finally get comfortable and fall asleep, and you're getting woken up again because those beds are not comfortable. So yeah, you never get rest and you never heal in hospitals. So sorry, just lost my train of thought. So on top of the medical teams and everyone that you're meeting, you're also given like a bunch, or some of the time, not every time, a bunch of different treatment options, which is also intimidating because that's their job to know what's best for you, right? Like, that's what you have training in. That's what your degree is in. I know nothing. And so when they were giving me options like, do you want to terminate your pregnancy and start treatment, or do you want to wait and then deliver early and then start treatment, or do you want to start treatment now? And I didn't know what the pros and cons of each one were. All I knew was that chemo was going to suck, and I don't know what's going to happen to my baby. So I was asking, and I asked multiple times, like, what does it mean if I were to terminate the pregnancy? What does it mean if I were to keep the baby? And does it change my treatment path? Does it change my chances of living? Does it, what are we looking at here? And it wasn't until I went from Lubbock back home to MD Anderson in Houston that I kind of got a little bit of an answer to that. And it basically was, we don't know what's going to happen. And even though it didn't really help me a whole lot, it at least told me that I'm not the only one that doesn't know what the heck is happening. Which is kind of comforting, but kind of not, especially when you look to your oncologist to put you on a treatment path. But that's just when they were honest with me, and they just told me there's just not a lot of literature, not a lot of people have been in this situation, which is a good thing because it's not like you want a lot of pregnant people being diagnosed with cancer, much less anyone else. So when they told me that it was just underweight, not just underweight, but underweight issues that we were going to be expecting if I were to start chemo, either way, she's born early, she's going to be underweight. If I start chemo, she's going to be underweight. We're prepared for the outcome regardless. So that helped me make my decision. Also, tumor testing is super important. That also told them that I wasn't going to respond to just one simple chemo. Of course not. Why would I? So it kind of helped us direct a path as to what our options were and weren't. And that's also something that other people just need to do, is just, if something doesn't sound right to you, or something just doesn't sit well with you within your gut, say something. Be like, well, why are we doing it this way? And you're allowed to ask your medical team why. Just because they know all the answers doesn't mean you don't need to just go and follow them blindly. Ask them why, know what they're doing. Now, some people just do better not knowing what's going on. And if you know that about yourself, then just go with it. But if you are like that and you do have that gut feeling, act on it. Say something, do something. I've also done a couple, like put the doctors on the spot and been like, if it were your daughter or if it were your wife, what would you do? And it kind of brings a little bit more of an explanation as to why they're doing what they're doing. So that kind of helped me get answers as well. But I'm also a very outspoken person, and I'm not afraid to irritate some people, especially when it comes to my health. So you meet all your medical staff that you're probably never going to meet again unless it's your oncologist and or OB if you're in my situation. But other than that, oh, you also meet a nutritionist, by the way, and then social workers, which is kind of funny because I'm a social worker and I'm going to badmouth them for a minute. Not really badmouth them, but you're just, these extra, is how I looked at it, these extra medical teams is kind of how it seemed, because nutrition is obviously important, and so is your mental health, but those are so minimal when you're wanting to get this disease out of you, right? Like, you're just like, cancer, okay, can we just, let's address this guy right here, and then we'll worry about me not eating any more cheeseburgers for breakfast, okay? I have done that. That's why I use that as an example. But some people just take, and it really just depends on how you are, but some people want all of the information and to just soak it all in. I don't have it with me, but I had a binder of handouts in lab work and everything that I would carry with me home. And I have an entire filing cabinet over here of my medical crap. But everything just kind of falls like in your lap all at once, and you kind of have to pick out what you want. So after you have all that information, as far as what's next, you have your treatment plan. I feel like I'm doing one for a client. You have your treatment plan, and you have all the tool. You have your toolbox and the tools in your toolbox. It's just a matter of how and what you need at that time, and you kind of need to be in tune with yourself, like to really listen to your body and know what you need. And if you're just, weak and, you're going through chemo, you can talk to your oncologist and find out like, hey, I talked to all these people. Can I have an appointment with one on nutrition? Or there's some centers that allow homeopathic treatment options in conjunction with Western medicine. That is a topic for another time. I actually need to write that down. Yeah, that's it. That's a good topic. But I guess the point of this one is just to know that it is a very overwhelming feeling, not just being diagnosed with cancer, because that alone is overwhelming, right? I mean, no one wants to be told that. But on top of that, this is what these people do on a daily basis, is find out people have cancer, and then they meet with them and they treat them and they do this and they do that and they have all this stuff that they're doing, but they forget that this is your first time. This is your first time ever being diagnosed with cancer. You've never been here before. Excuse me. And they are also human, so they kind of need to be brought back down. And it's okay to be overwhelmed, and it's okay to tell them to come back. Like, if you want the medical team, can you come back in a couple hours? Can you let me process this information? And I wish I did that for myself. I met with the oncologist and OB. I didn't need to meet with the 18 million other people that walked in and out of my what the heck is it called, hospital room. And that's just, for today's video, my biggest advice would be to allow yourself to process. And it is okay to feel overwhelmed and not want people all up in your business, because you have a lot going on. But next time I'm going to touch on, what is that? Oh, just how it is to get ready to go into chemo, your first treatment, what it's like, and just the experience of being in the infusion room. So on that note, I hope everyone gets a little bit of something out of this video, even if it's just a laugh at me being ridiculous, because apparently I can't get my words out. And next week I will see you guys again.